Hi, my name's Hilary. I'm part of the Community Learning Disability Nursing Service in Hertfordshire. This is just a short video for care workers who may for the first time be caring for people with learning disabilities due to the COVID-19 crisis. We know that you're an amazing caring workforce out there, and believe me, I'm clapping every Thursday for you guys. You are fantastic. And really, caring for someone with a learning disability shouldn't be much different from anyone else that you already care for. But there are some aspects that you might not be aware of. So we just wanted to do this video to give you a brief glimpse into some of the core aspects to be mindful of when caring for someone with a learning disability. People with a learning disability die an average of around 25 years younger than the rest of the population. And this is partly attributed to something called diagnostic overshadowing. This is where the person's learning disability means the medical staff can miss key signs and symptoms of someone becoming ill, and this delays their diagnosis and their treatment. One of the main reasons for diagnostic overshadowing is communication. They may not be able to communicate verbally that they're in pain or that they're feeling a bit rough or feeling under the weather. So what can you do to make sure you can spot those signs and symptoms of ill health in the person that you're caring for? One thing you can do is do some background research, learn about the person, learn who they truly are when they're well. It's so important to talk to their carers or their family. They may even be able to send you a little video clip of what they're usually like and how they act, behave and look when they're on their best day. Because the worst thing you can do is assume that the person you're meeting is how they usually are and assume that that's down to their learning disability, because they may be way off their baseline. Their baseline is how they usually are. So please do some research and contact family, because once you know how far below their baseline they are, then you can really begin to ascertain how poorly they are to be able to communicate that to the doctors. Secondly, try and learn how they would usually communicate key things in their life. Sometimes it's very easy to misinterpret, because if somebody is non-verbal, they can have very, very effective ways of communicating what they want or what they don't like. But if you don't know it, it can be very easy to misread this. One lady I worked with, for example, she used to bite her hand and scream when she was really, really excited and happy and liked you. Now, if you didn't know her, that was very easy to misinterpret and assume that she was saying, "Go away and I hate you," and you'd back away. Now imagine how that would feel if you're trying to communicate, "Oh, there's that nice lady," and you're trying to say, "Thanks ever so much for coming to see me," and every time they came near you, you backed away. So it's really key that you learn key aspects. Another man I worked with would laugh hysterically right in your face. That meant, "Get out of here, I don't want you here." Again, very easy to misinterpret and think, "Oh, fab, he's laughing, it's great to see him." But actually, his next communication, if you didn't listen to him when he told you to go away by laughing, would be to slap you. Now that's really unfair on him, because all he's trying to do is use his communication tools to tell you, "I want to be on my own." So it's so important to not listen to his communication. So please do some research, find out again, how do they communicate, what are they trying to tell you, and help them not be anxious, not be scared, and not be frustrated by thinking people don't understand them. Thirdly, remember that some people are going to really struggle with this move to a strange environment with new people looking after them and not truly understanding why this is happening. It's going to be incredibly anxiety provoking. So think about what you can do to alleviate that anxiety. Again, it's back to research, communicating with the people who know them well, finding out what's the best way to help ease that anxiety. There aren't any blanket rules. Some people will want to be sat with and stroked and talked to. Another person will find it horrendous to have their hand stroked and have someone sitting talking to them. Some people will want to go through Easy Read to understand what's going on with them. Another person will just rip the Easy Read up and you've done the worst possible thing. So it's back to that research. Step into their shoes. Imagine how you would feel if you had no understanding of what was going on and why you'd moved there, and try and find the best way to alleviate that anxiety to make this as least stressful for them as possible. A lot of people in Hertfordshire who have a learning disability have something called a purple folder. This should contain all the information that you need around this person, so it's worth asking if they have one if they don't arrive with one, because inside there are things like, for example, on the red grab sheet pages you can see that there's a page that says what I'm like when I'm well, and it says this is how I behave, communicate and move when I'm well. And then another page that says what I'm like when I'm unwell or in pain, and there's some core information there about how they behave, move and communicate when they're in pain. An example I can give you is a man who I worked with who I visited his house, and he was in a terrible state. They were saying he was throwing furniture, he was very angry, he was screaming a lot, he was running around the room, and they'd been to the GP and they'd said that they thought he'd got stomach pains. Now the GP couldn't get near him because he was so anxious, and decided to leave it for 24 hours and, give him something to bring down his anxiety levels and then address it. What the carers hadn't told the GP and hadn't looked in the purple folder to explain was that the only time he'd behaved like this ever in his past before was when he was in excruciating agony because he'd eaten a pair of socks. Now that's a very different picture for the GP. If the GP had known that, he would have not been leaving him 24 hours. Fortunately, we rang the GP and explained that. He was in theatre that night, having consumed a vast amount of socks, and he would have died that day. He wouldn't have made it to the next day. So remember, you learning this person means you become their advocate. You help the health professionals to know what their baseline is, how far off it, and what they might be communicating. And that is absolutely a key role to stopping that diagnostic overshadowing, to stopping those delayed diagnoses, to stopping people with a learning disability dying 25 years younger of things that they could easily have been treated for had someone spotted what it was that they were feeling unwell with. Now, a GP has a duty to make reasonable adjustments for someone with a learning disability, and it's really important that you know about what those reasonable adjustments are so you can ask for those adjustments if they're not naturally happening. To think about reasonable adjustments, think of the word teach. T is for time. A health professional may need to give them extra time so they can process why they've arrived in their room, what's going on, what they're feeling, what's happening in this situation. If they're given that extra time, they may be more accepting of whatever that health professional needs to achieve with them, be it a physical investigation, be it treatment. So please ensure that the health professional gives them that extra time to process why they're there. E is for environment. Remember that where they are may impact how accepting they are of the treatment. So, for example, if you know that they're much happier in their room than they are in a communal area and the doctor turns up, then make sure that they're the place that they're most likely to accept treatment or investigations. A is for attitude. Attitude is the key one. This is about what the outcome is. It's not about, oh bless, he doesn't want it. It's about, if this person didn't have a learning disability, what would I achieve with them today? And if I can't achieve it because they're struggling to understand and accept what I want to intervene with, how can I overcome it? Because we don't want delays. C is for communication. That we've talked about. It's about, do they prefer to use easy reads? Do they want you to use more hand gestures, more facial expressions? Just think outside the box about how you can really communicate with them. And it's about alleviating anxiety to enable them to understand. So that's about what can you do to relieve that anxiety. So it's back to we talked about earlier about, do they like you to sit next to them and hold their hand, or do they hate that? Think about how you can communicate that they're okay and they're safe and what's happening is okay for them.
Hi, my name is Gavin and I am a man with a learning disability. These things can make a huge difference. As you can see, I'm quite an able man, and so if you'd met me and I wasn't walking and talking, you might think that's how I was normally, but it isn't. So it's really important to know how a person usually is. When it comes to reasonable adjustments, my purple folder says that my communication is really important to be adjusted. When I'm scared, I don't listen properly and I just agree with everything. If the doctor said, "Is your breathing feeling better today?" I would say yes, because I think that's what he'd want me to say. I would need you to help me communicate with the doctor. So you might say, "Gavin, think of breathing like a traffic light. Red is really bad and green is very good. What colour were you yesterday?" I would then say I was orange to green yesterday, but I'm actually orange with no green today. Thank you for listening.
And finally, H is for help. This is where we come in again. So remember, we're the Community Learning Disability Nursing Service. If you are struggling with any aspect that's relating to the person's learning disability and you're struggling to provide the care you would usually care for someone because of those barriers that you're not sure how to overcome, please do give us a shout because we can support through this. Here is a link to our website which has easy read and all the links for how you can get hold of community learning disability nurses for you. Thank you for watching.